Because when we talk about the norm, that was definitely probably the norm before, and in some cases it probably still is. People will end up going to their GP first, and if the GP isn't aware of any options out there, then they will tell them that they're going to have to learn to live with it, to cope in some way. But other than that, there are a couple of paths. The GP may refer them to an ENT or an ear, nose, and throat doctor for some further testing, and sometimes there are things that they can pick up that the ENT might be able to deal with surgically. It's very rare, but there could be things like a growth that's kind of pushing on a nerve that leads into our brain, and it leads you to hear a sound. And if you can remove that, then you can kind of get rid of the tinnitus. But that is actually quite rare. So in most cases, in the past, if people were not told to live with it, they might seek out something like a masker. And a masker is still a sound, but it might be like a white noise or pink noise or some random tones, and you might get them in like a tabletop speaker, or in some cases it could have even been through a hearing aid that'll play it. And a masker is kind of self-explanatory. It works to cover up or mask the tinnitus. So while you would listen to it, it would cover it up, but then whenever you don't have it on, the tinnitus is still there. And so it's more of like a tool to try to cope throughout the day. But depending on what you're using, especially if you don't have hearing loss, listening for 8 to 10 hours a day to white noise isn't necessarily ideal either. So that was something that existed. And then the final thing is counseling. We talked about the emotional aspect of tinnitus. So people have benefited from getting certain kinds of counseling programs. It could be cognitive behavioral therapy, or it could be something called tinnitus retraining, where they are kind of counseled by someone that has received specific training on this, which unfortunately is not always easy to find a person like this.
That sounds very niche.
Yeah, and you'll go through that counseling to help you to, I guess, not be as affected by the sound and try to see it as of a more neutral sound than before.